Welcome back to another segment of Four Brown Chicks. In this segment of Did You Know, we're talking about racism being declared a public health crisis. Now, I don't know if you guys are familiar with the area of public health, but obviously, public health basically is how we address health disparities around us in our community and how we can handle them. There's a whole like World Health Organization. I actually have a bachelor's degree in public health. I planned on working for the CDC when I graduated from college because I wanted to be like real in depth. I wanted to be an epidemiologist. Those are people who track like the status. Like right now, as a epidemiologist, I would probably be overwhelmed because they track the status of like infectious disease and stuff with all the COVID stuff going on. Anyway, that's neither here nor there. I just wanted to give some background information about public health and my connection to public health because I was very interested in hearing that they have declared racism as a public health issue because it very much is an issue. Racism is not just it's in our systems, and when our systems are impacting us the way they do, there is an issue. We can't go to the doctor and have our issues being addressed. Black women are 4 times more likely to lose their life in labor, like general labor. So there's so many areas where we're much more affected just simply because we are a disparity. We have the different disparities against us. And what I feel like is them acknowledging that racism is an issue is just the first step that they are at least acknowledging that there is definitely a problem and that it has definitely systematically impacted Black people and that there's something that needs to be done. So how do you guys feel about that?
Yeah, and I think to your point, the entire COVID situation is kind of what even exposed that because people of color were dying at such a higher rate, them looking at like, okay, well, what's going on where people of color, you know what I mean, are dying. And then they start looking at health and seeing that, okay, well, wait a second, a lot of times there are things like food deserts in those areas where, we aren't provided the option of getting fresh foods and things of that nature. There is the whole healthcare thing. Like there are just so many layers to what Bianca was saying. It was like it's very systemic how deep all of this racism affects just literally every area of our lives that ultimately impact our health as well. So I think it makes 100% sense why they are declaring it a health issue, a public health issue. And I just hope that now that it's been spotted out, now that we've said what it is, that there is real action going behind it to improve it. And that's the part again where it's kind of like, will it just be like more, fake band-aids to, oh, well, this will help, but in the end of the day, we're not getting to the root of the problem.
Mm-hmm. Yeah, I agree. Oh, sorry. Go ahead, Jazz.
No, you go ahead. I'll go after.
I feel like we can't even trust the statistics in health because they don't even count us in a lot of numbers. They'll be like, oh, Black men tend to have a 10 times higher rate to have heart disease, but not even think about, well, how was their health care leading up to them actually being diagnosed with heart disease? Where were these levels in place to prevent the heart disease? Especially as a Black woman, I'm not sure that I even shared this with all of you guys, but I have Crohn's disease. If you guys, our viewers, aren't familiar with that it is a digestive disease, like similar to irritable bowel syndrome. And I've been diagnosed with it since 2014, but I started having medical issues in 2010. It took me 4 years to get diagnosed. And I probably seen over 30 doctors before I finally was diagnosed. And even now, my healthcare is not taken seriously. Like I really want to get like a certain procedure done and none of my doctors will recommend it for me. I know a white woman who has the exact same disease as me, and she said she asked her doctor one time to get the procedure done and she got it done like in 3 months. And then, of course, she just tried to say, like, well, maybe it's the area that you're in, that those type of doctors. She's like, here in Cleveland, like the Cleveland Clinic is really good. And I'm just like, it ain't that, sis.
Yeah, I agree. And especially I've always worked in some type of nonprofit field, um, and been able to see, for the most part, children and adolescents that were being served. But now I also see children, adolescents, adults, and you definitely do see just a total different, when you hear these stories, you definitely do hear a totally different story when it's someone of color versus a white person. You just do. You hear they kind of get favored, and more than that, I feel like the doctors at least act like they care. So, I feel like if it's a white person, the doctor is going to do every single thing to make sure that, they get to the bottom of what's going on. If they have to send you around the entire hospital, they're going to do that. And with a black person, they kind of often water it down and tell you, these are your thoughts. This is what you're thinking. This isn't really what it is. It's just maybe you're over exaggerating or overthinking it. And that's unfair. And I also have a friend who we dance together, and she had the same situation as you, Shay, where she wasn't diagnosed with Crohn's until years later. And for me, I think that one was a little sad because she was diagnosed literally when she was accepted into her dream dance company that then she couldn't do because flare-ups. But she knew something was up all along and kept going to doctor after doctor after doctor. And they just kept telling her, maybe it's just, some stomach issues you're having, or, give it a few months, give it a year, then come back. And I think that they just put people of color on the back burner with just about everything. And so I'm glad that it did come out that racism is considered that, because it is, like, and it's affecting people's livelihoods. And not only that, it's affecting people, but then it's like, sometimes I feel like when you talk about like generational curses and stuff, sometimes it's inevitable because of how it's set up from the beginning. It's like, what did you expect? Where this is what they had. Because I think a lot of, parents who, are toxic or just not the best parents, that's not always their fault. Like sometimes that's like the hand that they were dealt. And it's very easy to, look at people and be like, well, why didn't you do this? Why didn't you do that? Why didn't you do this? They can't, like, because of racism. Like, so I hope that changes are made for our future generations to come.
I agree with Jazz. A lot of times black people get lazy. We get labeled as being lazy, but the thing is we're not lazy. We don't have the same access. We don't have the same opportunities. And weapons are formed against us before we even get out here and be able to establish ourselves. A lot of That's why it's so important for us to like try to establish like generational wealth and things like that, because a lot of other cultures have the up on us because they have access to the things that you need to be quote unquote successful. Like they don't have to worry about if they have the resources or if they can be supported or where their next income or meal or anything is going to be come from. Even when we get sick, then we have to pay for these medications. We don't have the same access to insurance. It's like we are always having to work harder in no matter what system it is, school, education system, even just at work. At work, as a black person, you're expected to do more. You're expected to be more just because of who you are. So I just feel like I remember going into labor with my daughter. And I mean, that was my first child, so I didn't know what to expect, but I had got an epidural and I just knew that that wasn't right. Like I was still feeling pain. And I kept telling my nurse that like I was uncomfortable, I was in pain. She's like, no, you're good. Like it's fine. Like, And then when it was time, she just wasn't trying to hear me. And then when the next nurse came and she checked me, she like, what is going on? Because I flinched when she touched me. And she's like, you shouldn't feel that. I had to get a whole second epidural. And it was just like, why couldn't you just address my issues in the first part? When I said, even when I even got into the hospital, they were like, well, she says she's in labor. Like, I wouldn't know that my water broke and I'm in labor. Like I say, because it is. Like it was just, the whole experience definitely had a lot of racist vibes. And it just showed like how we definitely get treated in the healthcare system.
Yeah, absolutely. And that's just based off of the actual illnesses we have, not even taking into consideration the things that cause certain illnesses like stress, depression, and all those things, and all of the racist stuff that happened to us throughout our life that lead up to us being so stressed out or so depressed, or just being the circumstances in our environments, that we just aren't afforded certain opportunities. Even just having a certain name on a job application will deter you from getting a job. Even being the only Black person in an office, you will not have your voice heard as much. You know what I mean? There's so much things that goes into place that ultimately plays into our healthcare that just every day we're constantly being profiled. Just our health is at risk. Even just to speak about the whole police system and that being a risk to our safety and health, and how racism plays a big part in that. And I'm just really interested to see, now that this is out there, what are they going to do to change this? I would prefer to see like the dismantlement of the police force, something like that. You know, I would prefer them being held accountable on larger scales. Like maybe they have to fill out specific paperwork dealing with people of color to say that these things are definitely being checked on as far as our health is considered. And or maybe we should be able to have some form of complaint or even file a personal lawsuit to say this person was personally responsible for me being sick because they didn't take my health seriously.
Yeah. Well, that was the thing. So it's only certain state code that has declared racism as a public health issue. So then it's up to those states to decide what amendments or things that they're going to address those. So while other states have actually took the action and have been putting together plans and offering things that they actually plan and doing amendments, other states have just like addressed it and then just like that's it. So I do want to see more states just not only addressing it, but actually putting some action behind it. Okay.
See if Missouri on that list.
Girl. But moving on, because I did want to talk about something that is also race related, because it just, if this was us, it just would not go down like this. So I don't know if you guys remember that Kyle Rittenhouse was that teenager who went to that protest. He was armed and he shot those people, walked away from the scene like it was no problem. Also said he had no regrets about what he did. He was just released on a $2 million bond. People actually fundraised to get him out of jail for this crime that he committed. And it just baffles me that people support hate that much that they would even go through lengths to release somebody like that from prison. When there's people like the young man who was in jail for stealing that book bag, and he didn't even steal the book bag, but yet he was in jail for years for that, who ultimately ended up ending his life for that.
It's so sick to think about it. Like, this person drove from one state to a whole nother state with a complete intention, with weapons, to hurt people and to kill people. And then this is obvious. Like, this is not hearsay. It was seen. It's pictures that was taken. People that have said they even seen police giving him high fives and stuff like that. And I'm just really concerned. Why is it we could literally do anything and there could be no proof and we can still go to jail for so long? And someone that is white, there could be so much evidence stacked up against them and somehow they're giving them the benefit of the doubt. Who knows where this is going to end up? Even when the case finally goes to trial, they're probably going to declare him insane or something and not hold him accountable for actually what he did, when nothing about that was him not being in his right mind. He purposely did that. He had the intentions, and just like you said, he didn't feel bad about it at all. And somebody like that just should not be let back into society. There's people who can't get out on bail and they ain't pay child support.
Right.
Yep.
I think it's ridiculous.
I totally agree. And I think the saddest part about it is just what it's showing. Like, it's showing like you make these hateful, moves and you get rewarded. So it kind of just makes you think like how much of, the justice system and everyone is kind of behind this whole make America great again, whatever that means. But it's you're literally just applauding hatred. And I do think he'll probably come out as, he has mental issues or something like that, even though there are tons of Black people who have mental issues as well. I don't remember the names of, the enormous amount of unarmed Black men, but I do know that one of the more recent ones that came out, which I think it happened like a year ago, but we're just not hearing about it. And he was actually a guy with autism, and the police wasn't aware of that. And it's like, that's an actual, mental illness. That's a disability that, unfortunately, because he was Black, it's like you're not allowed to have a disability. But for, a white guy who's really just gun happy because that's what he grew up with, hunting and, out in the field doing that, he can just use that mental health excuse so that they won't hold him accountable.
Yeah.
I feel like you guys pretty much covered it. It's really saddening to see. Because like I said before, I feel like every time you think, maybe there is progress being made, you just see another example that the system is still corrupt in many, many ways. So
Yeah, so you guys let us know what you think in the comments. You can tell us your thoughts about racism being declared a public issue, health issue. If you live in a state that you know for sure where it's been declared, and if you know if they're doing anything about it, let us know in the comments. Like, share, and subscribe our content, and we'll see you again in our next segment. Bye.